We really covered the gamut of treatment options. So everything from topical therapy, intralesional therapy, to systemic therapy. We talked about data that exists right now and also some interesting trials and data to come.
Yeah, our goal is to remind dermatologists that they need to be involved at every step, not just allow the oncologist to take over severe tumors, but we also have to use our combinations, all of our adjuvant therapies, and think like oncologists do when we shrink the tumor, keep the surgical margins small, and more importantly, keep the tumors away. That was mainly the crux of the conversation.
So we talk a little bit about topical 5-fluorouracil, and as well as imiquimod, going over a little bit of data and thinking about treatment, also a little bit about prevention of future keratinocyte carcinomas.
Yeah. Uh, Photodynamic therapy is still a useful adjunct, but we kept a little bit of that on the sideline. It was more about trying to encompass things that can be easily incorporated into the clinic day, management strategies that are more tolerable for smaller tumors, and then getting into, how do you use them with hedgehog inhibitors and checkpoint inhibitors as well. So all the combinations possible.
I think really two of the biggest advancements that we have had have been the hedgehog inhibitors, sunitinib and vismodegib for basal cell carcinomas, and then cemiplimab for the treatment of squamous cell carcinomas. So we talked about that, talked about some of the data and the studies and sort of practical tips for managing patients on these drugs.
Yeah, and the key was to remind dermatologists that these are our drugs. We don't want to necessarily give these away to the oncologists or not be comfortable with managing the adverse events. We talked about some strategies for hedgehog inhibitor side effects. L-carnitine, for example. Watching the lipids, fish oil, things like that for therapy, but also just again reminding about cemiplimab and checkpoint inhibitors that there's so many cutaneous adverse events that dermatologists have to stay involved with those patients who are getting them, even if we're not the ones doing the infusion.
Well, I can mention, the hedgehog inhibitors. Really, the things that can be, I think, most challenging for patients are muscle spasm and dysgeusia or loss of taste. Those are often reasons why patients stop. Patients will also have significant weight loss sometimes. They'll lose their hair, alopecia, so it can have some electrolyte abnormalities as well.
Yeah, the adverse event profile of check inhibitors is very broad, especially simple eruptions that look like acne, different kind of hypersensitivity rashes, or even infusion site reactions, ranging all the way to full-blown DRESS syndrome, and even anaphylaxis, obviously, in really rare cases. But a lot of the checkpoint inhibitor effects can be somewhat dose limiting when they're not recognized by dermatologists. And one of the articles we quote, it talks about why dermatologists should be involved in the development of these drugs so that adverse event profile reporting is accurate. Because unfortunately, a lot of the oncologists don't recognize a lot of the outcomes that are skin related.
That's a great point, Neal. I think sometimes while we may not always administer checkpoint inhibitors ourselves, I think one of the important roles that we play is helping patients to stay on them despite cutaneous toxicities. I think we're actually less daunted by some of these and feel more comfortable managing them than our colleagues in oncology, which is why working together as a team is so important.
Yeah. But we're seeing more and more dermatology clinics, especially those run by venture capital or institutions, incorporating infusions now, where we're actually getting more involved with the infusion themselves, which honestly is not that difficult. It just really just takes good integrative care and a little bit of multidisciplinary and some nursing care to go with it. But again, it's the recognition of the outcomes that we have to measure the tumors as well as watch for those cutaneous adverse events. So it shouldn't be that intimidating.